Hey everyone, welcome back to another Intellect nursing video. In this video, we're going to go over osteoarthritis versus rheumatoid arthritis. We're going to keep it very specific to the point and help you understand how to attack these questions for the NCLEX and the nursing exams and make it easier for you. So let's get right into it. If you haven't already, make sure you guys go to our flashcards inside the musculoskeletal system, and you'll see a flashcard specifically on this topic. If you want to, write some notes down along with it, and we'll go over all the content that you see on that flashcard, and we'll explain every little bit of it. So what we're going to do is compare each one. We're going to go over the pathophysiology, the signs and symptoms, and the management of each one. And then, of course, identify what makes them different than the other. So the way I like to think of it, osteoarthritis, think of it, it's a direct damage. So it's direct damage to the cartilage in between the joints. Versus rheumatoid arthritis, it's more of a chronic inflammatory disease that the body is actually attacking itself. So it's not direct damage. So think like I'm a football player, for example, and I've been spending years and years playing football. And over time, I might have osteoarthritis because it's just direct damage to my joints. I'm putting a lot of pressure on them. I'm using them a lot. And of course, they could get damaged during physical activity like that. So that's osteoarthritis. Versus rheumatoid arthritis is not necessarily the cause at all. It could just be you have an autoimmune disease, which is your rheumatoid arthritis. It affects the joints. It attacks the joints themselves. So we'll get into that part. But one big distinction with the pathophysiology that you'll be able to easily identify between the two, and this is how you understand which when the NCLEX questions come up or the nursing exams. Osteoarthritis is usually a localized area. So it's usually like, oh, a person's knee, their left knee specifically. If there's a question that gives you a case scenario that says the patient comes in or is complaining of left knee pain and there's no other joint pain anywhere else around the body, it's likely your osteoarthritis. Once again, that's direct damage to a specific area in the body. That's your osteoarthritis because that's talking about articular cartilage in between the joints, and it's related to maybe blunt force or just an injury in general. Versus your rheumatoid arthritis, that is a systemic inflammatory disease. So this is all of your joints. So it's not just your left knee, it's your right knee and your elbows and your fingers, whatever it is, that's more likely your rheumatoid arthritis. And the more joints that are involved, the less likely it's your osteoarthritis. So just know that's a very easy distinction between identifying which there. But to get into more detail, let's get into the signs and symptoms that they'll likely bring up in these exams as well. So let's first start with osteoarthritis. So the hallmark sign and symptom of osteoarthritis is your Herberdin's nodes. So think there's a D in the Herberdin's nodes. That is your distal finger joints. And by nodes, it means that they are swollen, of course, there's an inflamed. So that might be some progressive osteoarthritis there. And then, of course, once again, unilateral, usually so like one side, like the left knee, for example, that is a telltale sign and symptom that's osteoarthritis. There might be crepitus, which is the creaking noise, that like grating noise that you might hear in the joints. Of course, the joint's going to be swollen and it's going to be painful. Other signs that may be related to this, if the patients are complaining of a left-sided knee pain, for example, but they also have compression of the joints. So they might have a hunched back, for example, so that's the compression of the spine. So it's a degeneration of joints over time. So that's your osteoarthritis. Now getting into these signs and symptoms for rheumatoid arthritis. So once again, think the rheumatoid arthritis is a systemic problem. So you're going to have symptoms everywhere. So usually these patients wake up super stiff and it takes them over 30 minutes to feel like they're back to normal again. They're going to wake up stiff and painful. The joints are going to be very stiff and painful. That is considered one of the hallmark signs and symptoms. These patients could also have signs and symptoms such as a low-grade fever, or they could have weakness or fatigue, anorexia, weight loss, and diagnostic, they might have an increased ESR, which is considered a marker for systemic inflammation, or a rheumatoid factor, of course. Once again, rheumatoid arthritis is systemic. Osteoarthritis is usually localized pain somewhere, but rheumatoid arthritis could eventually cause symmetrical joint deformations or muscular atrophy. Now getting into management and comparing both. So osteoarthritis, it's kind of like your typical treatment. You're going to give NSAIDs, you're going to give things that will control the pain, so something such as ibuprofen. These patients might get localized corticosteroid injections into the joint as well, which helps with the inflammation and reducing that. They'll use warm compresses If it's acute, then of course they're going to use cold compresses within that 24 to 48 hour mark. If it is severe, they may have to immobilize the joint so it doesn't increase the amount of inflammation over time. And over time, for quality of life, for example, they might want to encourage the patient to cluster activities together so they're not so fatigued all the time, and it's better and more manageable throughout the day. And they might have to promote physical exercise because actually, when you strengthen the muscle surrounding it, it will help become more supportive for that joint. Now, the non-pharmacological therapy is pretty similar with the rheumatoid arthritis, of course, because it is a joint at the end of the day, right? Now, also with the medications, though, it's going to be different. So there's something called DMARDs, which we'll run a list here and also show you just the common medications you may see, especially on your NCLEX and the nursing exams. Those are there to reduce the episodes related to rheumatoid arthritis. And then, of course, you're still going to be given things such as NSAIDs to reduce the inflammation. And once again, same thing with you're going to cluster activities together and promote physical exercise when you can. All right, that breaks it down. If you want to understand the difference between osteoarthritis and rheumatoid arthritis, make sure you guys write those notes down that we just went over. Use the flashcard. That will help you identify, first of all, which one it is that the NCLEX and the nurse exams are talking about. And then you'll be able to see what hallmark signs and symptoms, using those as well, and then understanding what the management will be. Thank you all so much for watching, and I hope this was helpful. We will see you in the next one.